Dr. the Honorable Timothy Harris. These press conferences are held regularly so that members of the media are given an opportunity to interact with the Prime Minister and members of his cabinet. I take this opportunity to acknowledge the members of the media who are here. Thank you so much for joining us this afternoon, as well as various officials coming from the Ministries of National Security, Health, Tourism, and others. I'd also like to use this opportunity to single out the members of Cabinet who are joining us today, and they are usually here to assist with answering questions. We have this afternoon the Honorable Vincent Byron, the Honorable Eugene Hamilton, the Honorable Wendy Phipps, the Honorable Akila Byron Nisbet, and the Honorable Lindsay Grant. This press conference is being carried live on Freedom FM, Sugar City FM, Vaughan Radio, Win FM, ZIZ Radio and Television, as well as various social media platforms, including the Facebook pages of ZIZ and SKNIS Media, that's the St. Kitts and Nevis Information Service. They are also carrying this press conference live on their YouTube channels. Dr. the Honorable Timothy Harris uses this platform to update the nation on matters of national importance. And at this time, allow us to welcome him. He will make his opening presentation, and then we'll open the floor for questions. I'm asking that media houses limit their questions to 2 questions per round. So when you get to the microphone, you'll be allowed to ask 2 questions, and then you will give someone else an opportunity. And at the end of the first round, if there are any other questions that have not been answered or you have follow-ups, you'll be allowed to do so. So I look forward to your usual cooperation, and I would like to welcome the Dr. the Honorable Timothy Harris. Mr. Prime Minister, allow us to stand while we welcome him.
Good afternoon, please. Let me thank Ms. Bryan for presiding over today's press conference organized by the Office of the Prime Minister, and to thank my cabinet colleague and recognize them, the Honorable Lindsay Grant, the Honorable Akila Byron Nisbet, the Honorable Wendy Phipps, the Honorable Eugene Hamilton, the Honorable Vincent Byron, the Honorable Eric Evelyn, and we have our ambassadors, His Excellency Ambassador Sidney Osborne, our Ambassador Plenipotentiary, Ambassador Van Samry, our Ambassador, His Excellency Michael Powell. We want to recognize the Deputy Financial Secretary and other senior functionaries of the government, including those from our law and enforcement agencies. We want to thank all our citizens and residents who are tuning to this press conference. For us, this is an important part of our promise, good governance agenda. And I consider this opportunity to give account to our citizens and residents a distinct privilege, and may I add a sacred duty. Today I want to update the nation on the work and activities of our government over the last several weeks with respect to 3 broad critical areas of national interest. These areas are safety, relief, and recovery. Over the last 17 months, your Team Unity administration has focused its efforts on these areas in order to deliver the stronger, safer future we promise. We have been working hard to keep our citizens and residents safe from the dreaded COVID-19 virus. We have been provided much needed support and relief to those affected by the COVID-19 pandemic. We have been implementing initiatives that will facilitate our economic recovery. We believe that by focusing our efforts on these areas and more, we will ultimately deliver the best possible quality of life and indeed the stronger, safer future that we promise, even in the face of this pandemic, which has wreaked havoc across the world. Safety and security are fundamental to societal order, good governance, and democracy. In 2015, we came to office against the backdrop of the disappointing failure of the past administration to keep our people safe. Homicides had reached a record high of 35 in 2011. Since assuming office, we have reorganized our security forces, enhanced manpower. We devised and are implementing the first national security strategy, which arrived out of extensive consultation. We increased budgetary support to national security from 62.8 million in 2014 to a record high of 99 million in 2020, followed by $86.2 million in 2021. We created new programs like the Alternative Lifestyle Program, ALP, and the Explorers Club. We are seeking to redirect our youths from the path of crime. We are emphasizing rehabilitation and reform in our prisons and positive engagement with youths in society. Today we have the largest national group of young persons organizing constructive activities through the Explorers Club. Over 1,200 young persons are participating in the club under the tutelage of our community policing team. Major crimes, including homicides, are trending significantly downward. Of course, we want to reach the ideal of 0 homicides per year. So far for the year, we have seen 7 regrettable cases. Last year, we had 10 for the entire year. We will continue our unwavering efforts to keep our people safe. In my view, the loss of any life to crime is a collective tragedy. COVID-19 is a major threat to societal peace around the world. You would have noticed the number of deaths, the lockdowns, and divisiveness across countries and societies far and near. To effectively fight COVID-19, we need to work together for a broader public good, which is our collective safety and security. COVID-19 is now being considered an existential threat to human security. No one is safe until all are safe. Hence, we must fight together and present a united front. The most powerful tool in our arsenal is vaccination. Our vaccination scorecard is an excellent one. However, we must never become complacent, but continue to vaccinate until we get everyone vaccinated. Given the arrival of the Lambda variant and the prospect that other variants may have entered our federation, we can expect surges in cases from time to time. We will only be able to check and contain the virus by having more of our people, I dare say all of our people, vaccinated. The higher the proportion of the population in our society that is vaccinated, the safer we will all be. We in government have come to trust our people's judgment. The vast majority of our people have done the right thing so far, and of their own free will, they went forward and they took the vaccine. We commend them. They are safer because of it, and our country is better for it. I will continue to appeal to all our citizens and residents to get vaccinated. This is the only way we will remove ourselves out of the shadow of COVID-19. August 12, 2020 was a very important day for the people of St. Kitts and Nevis in our fight against COVID-19. We received then a donation of 11,700 doses of the Pfizer vaccine. We took yet another step to protect our adolescents and adults from the virus. We made yet another significant step in our journey towards delivering the stronger, safer future. On September 1st, we will begin to administer the Pfizer vaccine. I was reminding everyone that the Pfizer vaccine will be available to every individual 12 years and older. In other words, it will not just be for those of our students and those who are under 18, but anyone can have the Pfizer vaccine if they so desire. I want to encourage all who are interested to begin to make appointments at our health centers. I turn now to an update on our relief measures. Last Tuesday, August 17th, I reported to the nation on our comprehensive, targeted, and far-reaching stimulus package, which has brought relief to many people, especially the poor and vulnerable affected by COVID-19. This stimulus package is also expected to contribute to economic recovery. We provided this package of support notwithstanding the very destabilizing impact of COVID-19 on government tax revenues. We did this because we are committed to delivering the best quality of life to all our citizens and residents. In fact, we have given several tax waivers and deferrals over the last 17 months, even though this has further reduced cash inflows for the federal government. We did this because for us, people matter most. We feel their hardships and pain, and we will do all we can to lessen their difficulties. We are asking our people to protect themselves, get vaccinated, so that they can get on with their lives and contribute to their well-being and that of their families and loved ones. I am committed to supporting our people, especially those who are having a difficult time and require a hand up and a helping hand to usher them out of poverty, out of abuse, out of a life of criminality, out of extreme dependence. Yes, I will never ignore those who are lagging behind. Our stimulus package will help to temporarily bridge the gaps and inequality in our society brought about by the deadly COVID-19 pandemic. Our social safety nets are intended to reach the deprived communities and help them to improve their quality of life. Through our poverty alleviation program and a wide range of social safety net programs scattered across various line ministries such as health, education, social development, well over $50 million will be spent this year to bring some semblance of dignity to our vulnerable sons and daughters, including battered women, foster children, and those for whom we are bringing other real improvements in other areas of their lives. Turning to the income support program, this was the $1,000 per month to those who had been unemployed for an extended period during this period of the pandemic. The poor, vulnerable, and unemployed are benefiting from this income support program. I am pleased to report that to date, a total of 3,733 applications have been received by the Ministry of Finance. That is as at the 23rd of August, 2021. Of this, 1,886 applications have been approved. Claims will be processed daily until the cutoff of the 15th September 2021, when no further claims will be accepted. So what is in the system up to that time will be processed. After the 15th, we will not be receiving any new applications to any of the programs under the stimulus. Turning to the fuel subsidy, a total of 106 applications from bus operators have been received by the Ministry of Finance, and a total of 92 have already been approved. Disability support to families with disabilities, a total of 119 applications have been approved. Additionally, to support trainings at Addie's Place, we have provided a grant of $15,000 to that institution in Greenlands. Addie's Place is preparing persons living with disabilities with skills for work and effective engagement in society. My government is serious when we say no one will be left behind. Hence, we made this special carve-out for families taking care of persons with disabilities. Our food truck vendors support. All applications received from them have been approved by the Ministry of Finance. I turn now to the matter of our economic recovery, and I report that our recovery is moving apace. We have not yet fully there. We have not recovered all the ground lost, but we are moving in the right direction. This, of course, is best measured by the performance of the key economic drivers. At our cabinet meeting on Monday, August 16, we took a decision to spur cruise tourism by making a major concession to allow vaccinated cruise passengers to enter the Federation utilizing the antigen test. In making this decision, we took note of the following. 1. Once visitors are fully vaccinated, the risks of their transmitting the virus to our people is significantly reduced. The strong rollout of our vaccination program has seen St. Kitts and Nevis emerged with over 62% of the adult population fully vaccinated. This is one of the highest in the hemisphere, and over 73% having taken at least their first dose of the AstraZeneca vaccine. This significant higher level of vaccination provides a further level of protection against the virus. Of course, we must never become complacent or drop our guard. Thirdly, the coordinated efforts to manage cruise visits through bubble arrangements will result in a safe corridor of containment. For with the advent of the Pfizer vaccine, even more persons can be and will be protected. The 5th point with respect to this is that the opening up of the cruise tourism will put thousands of persons back to work, increasing income flows and business activity. We took note that for 17 months, a large number of persons like taxi operators and some employees at duty-free shops at Port Zante and elsewhere have been without meaningful work. A brighter future now awaits them. They, however, should minimize their risks by getting vaccinated and observing all protocols. The sixth element we took under consideration is that the heavy dependence of state-owned enterprises such as Casper and Solid Waste and budgetary support from the federal government will be lessened as they will receive their own steady inflows from cruise business. For 2020 and 21, my government supported these entities to the tune of $12.4 million. And finally, the opening up of the sector will safeguard our heavy investments in cruise tourism and consolidate the gains so carefully built up over 6 years by my administration. The success of this is that St. Kitts and Nevis became a marquee port 2 years in a row, amassing over 1 million cruise passengers to our shores. We thank all the stakeholders and the Ministry of Tourism, led by the Honorable Lindsay Grant. St. Kitts and Nevis recorded the fastest growth in cruise tourism in the region. We will build on this even as we diversify around tourism and increase our stay-over arrivals, thereby building a stronger and more resilient economy. Turning to stay-over tourism, I am pleased to report the following in terms of the major air carriers into St. Kitts Nevis. American Airlines. I'm advised that the Miami daily flight to St. Kitts will resume on Tuesday, November 2nd. This flight, I gather, is already loaded. Delta, Atlanta. Saturday daily flight will end at the end of this month, but will resume during fall, providing a Saturday service. United Airlines. The Saturday weekly flight will resume on Saturday, the 18th December 2021, and will continue into the winter season up to around the 30th of April 2022. British Airways. The flight should commence once weekly service, starting on October 3rd and October 10th. Thereafter, it is loaded to come twice weekly, Saturdays and Wednesdays. Canada. Air Canada is loaded to commence Sunday, November the 7th, and this will continue throughout the winter season, climaxing on or around the end of April. In sum, we are expecting a much improved last quarter in 2021 relative to 2020 and a satisfactory winter season in 2022. Of course, our tourism officials are at work to even expand and to consolidate further traffic into our country. A word on education tourism. Our offshore institutions of learning are making a significant impact on economic life of our country. Thousands of persons come to St. Kitts and Nevis to participate in learning and work as students and faculty at institutions like Ross University, Windsor University. Their contribution to our economy has increased retail and wholesale activities, supported the restaurant and hospitality subsectors, and indeed home and car rentals are direct beneficiaries of this increased influx into the country. We are satisfied that the largest of these offshore learning institutions, Ross University, has already successfully, working with our national task force, repatriated about 1,700 students and faculty to St. Kitts and Nevis. Windsor University has advised that it has advanced its own plans for reopening in the fall of 2021. Turning to the manufacturing sector. The manufacturing sector is showing signs of a recovery. Most of the manufacturing entities are operating. Over 1,200 persons are back to work in that sector. Exports have shown growth. Records from the Customs and Excise Department reveal that the dollar value of merchandise exports increased to $58.6 million for the period January to July 2021, from $53 million in 2020, for an increase of 10.6%. The exports are mainly generated by our enclave manufacturing sector. Some companies should come readily to mind: API Harrow Server Limited in Sandy Point, Jaro, Cajola Cristada. The brewery has been engaged significantly in exporting our sub-region, but we should also add Brush, the Mararo Distillers Limited, among several others that are engaged in export manufacturing. I turn now to agriculture and fisheries. Crops, livestock, and fisheries are performing much better in 2021 relative to the same period in 2020. This is due to the targeted support being provided to the sector. Over the period January to June 2021, crop and livestock combined recorded a 25% increase in production. The dollar value of crops and livestock produced was put at $5.5 million, an increase of $1.1 million over the $4.4 million recorded for the comparative period in 2020. Gains in production were recorded in cabbage, in onion, cantaloupe, cucumber, tomato, watermelon, and yam. So if you really want fresh produce, go to our market. On Saturday, indeed, 6 days a week we are open. And we have also expanded the range of opportunities in terms of access. At Borio, any day, you can get yams and potatoes and cabbage and onion, watermelon. Anything that is in abundance, you'll find at Borio. But equally, just out at the outskirts of Bar State Cannery, we intend to develop that as another important market. And indeed, for some time now, a group of young farmers have taken on the task of reorganizing the old market in Sandy Point and making it available for fresh produce. Livestock production recorded gains in output. Beef went up by 24%, goat meat 27%, mutton by 7%, and pork at 18%. Overall gains in productions have been put at 20% over the comparative period in 2020. It is also of note that we have 1,100 registered farmers with the Ministry of Agriculture. 970 are males and 130 are females. I want to thank all of them because I consider them to be ambassadors for our food and nutrition security. I want to urge all farmers to register as self-employed persons with Social Security to protect themselves against loss of earnings and, of course, to secure their pensions in later years. The COVID pandemic exposed the vulnerability of many persons who did not engage and participate or register with the Social Security. When their darkest hour had come, they had nothing to look to for support. The Social Security was devised and was intended to be of assistance to our people in their most vulnerable times in life, be it at sickness, be it an occasion of maternity, be it an occasion of injury, be it an occasion of death. at all those vulnerable occasions, the Social Security was intended to come to the assistance of our people. But for them to benefit, they had to contribute little by little over their working years. So again, I want to encourage all the farmers, again, to put a little aside as your contribution as a self-employed person. Turning to the fisheries subsector, overall fish landings for the period January to July 2021 were recorded as 442,830 pounds, with a landed value of $4.9 million. This represented a 25% increase over last year for the comparative period, which is January to July in this case. The most significant year-on-year movement so far was seen in the landings of lobsters, which increased by 150% over last year's outturn. Additionally, reef and demersal fish, that is snapper, hind, butterfish, surpassed last year's output by 26%. In other words, there is an abundance of what we call pot fish in St. Kitts at this time. Conch fishery has shown a 17% increase. We have 1,200 fishers who are registered with our Marine Department as of July 2021. In fact, the exact figure I was reminded by Dr. Mark Williams is 1,289 fishers. These are a significant number of persons, significant numbers who are engaged productively in an independent way, earning their own keep. A lot of them are not recognized formally in the Social Security system. I want again to urge them to the wisdom of doing so. So when we look at our employment statistics, we are talking then of about 1,100 thereabout in farming registered with the Ministry of Agriculture, 1,200 registered with the Marine, for a total of about 2,300 persons. Significant number. Make the deduction for some overlapping. The crop farmer could be a fisherman also. A significant number will not be shown in the formal statistics at the Social Security Department. The significant improvements in our fisheries output and income, like with crop and livestock, these are the direct result of the government's efforts to build an inclusive society where everyone can do well. And we specifically targeted food security when we unveiled our stimulus package, providing, for example, for our fishermen fish pot wire, support with their injuries and other inputs required for them to ply their trade successfully. Department of Marine Department introduced the FADS, Fish Aggregate Devices. Do I get it right, P.S. Collins? That again should help in a more bountiful harvest for our fisher folks. Another important growth driver for St. Kitts and Nevis is the construction sector. Several important private sector projects are taking place. The Royal St. Kitts Hotel has started its third major project, Plaza 2, while simultaneously building its luxury villa projects. Before that, they started the Cove condominium project. I'm advised this is now completed, and all that is left is for it to be appropriately furnished. Galaxy is about to start phase 2 of its hotel project at Whitegate. Phase 1 is being prepared, I am advised, for a soft opening this year. Phase 1 comprises 300 rooms. Hillsborough Suites and Residences is working to complete phase 1. This project will add 40 rooms to our residential stock, and this, of course, is located in the McKinley area. I want to thank Dr. Valentine and his wife, who have invested significantly in this project. Dr. Valentine was one of the first persons to have operated at the executive level in the build-out of our Cbi program. But so far, this program has been funded substantially by their own independent efforts, or their efforts independent of the Cbi program. So I want to thank them for that confidence they have shown in the economy. The Royal Limited is completing phase 1, and this will result in 196-room condo project in West Barstow. TDC Duas Residential Development, I'm advised by the Executive Chairman, is progressing smoothly. Private residential construction is continuing, supported in part by the government first-time home mortgage program. Up to the 11th of August 2021, 90 applications for duty-free concessions were approved by the Ministry of Finance on materials totaling $14.5 million. So every citizen who wants to make a fresh start in a long-term investment in property ownership, they can apply to the Ministry of Finance and they will get duty-free concessions and building materials. That tantamounts to a substantial saving in the cost of home ownership. The final growth driver for our country is our Cbi program. And our Cbi program was this week ranked #1 by Professional Wealth Management, the magazine published by the prestigious Financial Times. This, in my view, is a tribute to the high-quality performance by our employees and key stakeholders who work hard to maintain the platinum standards associated with our widely respected Citizenship by Investment program. The program has the most rigorous due diligence requirements, and it is the most efficient and innovative in the world. While the COVID-19 pandemic has affected the marketing modalities, the program is performing relatively well in accordance with our 2021 expectations. One of the innovations we have introduced is the alternative investment option, which provide an opportunity for the government and other private partners to come together and to work on some project of importance to the government, while at the same time a private party then can receive substantial rewards by participating to the Cbi program. And there are a number of projects that have been put to us. We have for long been talking about our prisons, which is critically important because 1840 should really have long lived, and we need to find a new place. The cost of building a modern prison is substantial, especially one that is targeting at rehabilitation and reform, so that when people leave the prison, they are ready again to re-engage in society. They are ready again to be loving fathers and loving sons and daughters. They are ready again to go to work the next day. So inside that prison, we have to have the various facilities that would accommodate that. Workstations, teaching them new trades, counseling them and supporting them, providing for their own health care, so that we don't have the situations which exist now, where we may have a number of prisoners in the line waiting for health care at some of our health centers. We would want to have as much as could be done within. And so that facility, we have expended probably about $3 million so far to one of our local architects, Stacey Hobson, to do the design and redesign of that particular facility in keeping with our ability to finance it. Now that we are having interest in that as a result of the launch of the alternative investment option, we can say comfortably that certainly we will be starting this soonest. Once, of course, the project is evaluated by the committee established in the regulations. But it shows interesting thing, and it shows why independent observers, having looked at our program, evaluate it to be as being the most innovative one in the world. We continue to listen to the market. We continue to heed the advice of professional people who are advising us with respect to the Cbi program. We are aware of some of the challenges. We are aware of what happened before we came to office. And we have been working very hard to do the very best we can to make it genuinely the platinum brand that we want it to be. In closing, our government promised a stronger, safer future. And with God's help, we are determined to continue our progress in spite of the challenges of the pandemic. And what I have outlined sector by sector indicates that the government have moved in a very careful way to open up all sectors of St. Kitts and Nevis, all critical sectors, while at the same time being true to the mandate of the government to keep its people safe. We have outlined some of these initiatives before. You have heard me repeat some of them today. We believe in particular that working together, one people, one nation, that we can achieve quite a lot, notwithstanding the challenges that COVID-19 represents. The COVID-19 pandemic, of course, is not yet over. And every day, each of us must remember that, so that our behavior is circumspect and reflective of the reality that it only takes one. It only takes one person not to abide by the protocol, to behave irresponsibly, to gather crowds in ways that create super spreading for things to get out of control. The government, of course, is a caring government, but COVID-19 demands personal and individual responsibility. I want again to appeal to all of us, all of our adults, to do the best we can to protect ourselves. Together we can make it work, and together we can deliver the stronger and safer future for all the people in St. Kitts and Nevis. I would want to pause now and to allow the representatives of the media to pose any question that they may have at this moment in time. Let me also recognize our Minister of Education, the Honorable John L. Powell, who has also joined us.
Good afternoon, Lashan Dixon, St. Kitts and Nevis Observer. We have seen the unvaccinated face threats of restrictions and losing their jobs. What safeguarding will your government offer to those who choose to remain unvaccinated as it relates to keeping their jobs, being able to source jobs, and being able to fully participate and not left behind as a citizen of St. Kitts and Nevis? Secondly, you spoke about offshore schooling, but is the government looking into the growing trend of students, overseas students, studying online and circumventing the need to come on island for school, and considering the financial implications this could have on the country's economy.
Good afternoon, Kevin Brown for WinFM. Concerning the electronic vaccination cards that was announced recently, has the Ministry of Health discussed or arranged for such cards to be accepted by other territories, regionally and internationally? And secondly, is there an update on the local hush puppy bribery investigation? Has anyone locally been identified as a co-conspirator or charged?
Could you repeat again your name and your first question, please?
Sorry, Kevon Brown with WinFM. The first question was concerning the electronic vaccination cards. I was wondering if we could get some more details on that, and has any discussions or arrangements been made for them to be regionally and internationally accepted?
Jason Davis, ZIZ Broadcasting Corporation. It was mentioned earlier that cruise visitors would be allowed to enter the Federation after using antigen tests, which basically are the rapid tests. They've never been used before here. Why are they being used now? And secondly, for Minister Grant, could we get an update on cruise tourism out of Florida? I know there was a kerfuffle concerning a court case with the governor there, and that impacted us. So what's happening there?
All right, we'll pause to get of Florida. You have identified the Minister of Tourism, so he will address that. And he also have Mrs. Brown, who is our Chief Technical Advisor in that area. The matter of the rapid antigen tests, as you describe it, we will have some input from that, from the CMO, and also we have the vaccination cards. Our Minister of Health will address that. The matter of hush puppy, Mr. Brandy is here and quite ready to address that. The other matter, the online studies and the protection of the unvaccinated, I will make some comments on that, and of course the Attorney General is our chief advisor on these matters of law. But generally everyone in St. Kitts and Nevis has the protection of law. The Constitution protects everyone, vaccinated and unvaccinated. And if there is anyone feeling aggrieved in any way, there are, of course, appropriate mechanisms to be pursued to satisfy their particular interests. This is, of course, a matter that is critically important. This is a matter in which all of us have to show great patience, great understanding, and appreciate that individual rights also come with responsibilities. And what we are asking everyone in St. Kitts and Nevis to do is really do the responsible thing. The government has not and will not force anyone to take the vaccine. But the science is clear. The evidence everywhere is that unless you get vaccinated, the virus will find you. And if you are very unlucky, it may very well kill you. We have what the scientists have now described as the pandemic of the unvaccinated. Everywhere, those who are unvaccinated will suffer more terribly the consequences of COVID-19, whether it means ending up in the hospital, and we had some like that here, and ultimately the worst demonstration of it is that persons could lose their life if they are not vaccinated and if they have comorbidities, etc. And we really don't want that. So we are asking everyone to behave responsibly. And we hear both sides. We well appreciate when for medical reasons some persons say they can't take the vaccine. And once there's a medical reason, then we can't ask you to do otherwise. There may be some who, for religious reasons, would not take the vaccine. And we accept that. Again, that again goes back to the constitutional protection accorded to some people. But we don't want in this pandemic for people to be so focused on I. We want people to be focused on us. What is in our collective best interest as a people? How will we fight this together? Because unless all of us are safe, we're really going to be fighting a losing battle. We have seen circumstances where innocent children in our primary schools, in our secondary school, lost critical elements of instruction because somebody who should have been vaccinated chose not to do so. And then the children suffer for loss of educational opportunities. An entire school meal program had to be closed because somebody determined that they were not going to take the vaccine, perhaps unmindful of the consequence of what their particular situation can do. We have had a number of businesses who had to close the last 14 days as they wait for the results. So we see that this is not an easy matter. And again, it is more than I. It is all of us that we have to consider. When we look at the young children, we say to parents, if you love them and they can't protect themselves, would you protect them by getting vaccinated? It's not just about I, it is more about us. Would it be that we be a country where people are just coming down week after week, unable to work, unable to contribute, in constant lockdown? Because for some of us, it is just I. We would rather that people think about us. So again, we continue to encourage persons, and we are inviting responsible media, because we do know what the science is saying. And you must ask yourself, how come all over the world, every country is saying the same thing? Vaccination, vaccination, vaccination. It's the only way out. The most powerful country is talking about vaccination. And they've gone further because they're talking about mandatory vaccination, because for them it is critical if the country is going to move forward. In Canada, they're talking that you can't take certain public transport unless you are vaccinated, because they are concerned not just with I, but with us and with the broader country. And so, yes, there are some persons who will be exempted, and we understand their reasons. And there are some persons, of course, will advance no reason other than it's I. At a time when persons are losing their life, at a time when, for example, in Jamaica, the health system is being overwhelmed, too many people getting sick. We saw some photos the other day out of Guadeloupe, overwhelmed. Persons are in the corridor in the hospital, waiting and begging for some oxygen and some other things to keep them alive. When that happens, people are going to die. That is the result we have seen in England, in India, everywhere. Once the health system get overwhelmed with persons who have been caught or infected by the COVID-19, the consequences are going to be serious. So we just ask people to exercise wisdom, to think about it, to pray about it, and maybe even pray and fast about some of these things which are difficult for people to understand and to come to deal with. And so, again, though, fundamentally, everyone in St. Kitts, we support their right to work. We support that as a government. The laws and our Constitution offer that protection. And where persons feel aggrieved in any matter, of course, they have access to the legal system to deal with that. And the government will defend people's right to work. The government has done that always. The matter of the online studies, I think there was the proposition put that we are having online and less people are likely to come. The online education platform is working both ways. Many persons here, right here, are using online to pursue educational opportunities, and that has the beneficial effects. Of course, some of the very institutions here are also now ensuring that their platforms allow them to purvey education by way of online modalities. But generally, I think it is accepted, not just for children, that there really is no substitute for in-classroom purveying of education. That was what the results that came out in England, the UK after the shutdown, that children really needed to be in school for all the intangible and the tangible assets that come from in-classroom setting, and which we can't replicate fully. So there will still be a need for in-classroom setting for persons to come to St. Kitts. Indeed, a number of them who participate in ROS, they do a portion of their studies here, then they go to their own country or other islands and they pursue additional studies. So I believe that in the end we have not been disadvantaged. And I reported that so far Ross University has a roll of about 1,700 students and faculty, and that is a significant development here. The vaccination card, I will invite the minister and then the CMO will come to give any reflection, and then we have the Attorney General who will want to come. He also leads in terms of the Mitigation Council and a lot of these matters in terms of our approach to vaccination, etc., which so far has been highly public, highly educational, and inviting and encouraging people to see their own self-interest and the national interest in getting vaccinated. Again, we have not forced anyone to be vaccinated. And of course, we are for the protection of employees' rights. Minister, then we will have perhaps the Attorney General, and then we will have the CMO and any other, well, the Minister Grant will then come. The last matter though, and while our CMO will adjust it, I think I outlined some 7 reasons why we had moved to make the concession with respect to the antigen tests. So I've offered 7 reasons. I'll ask when you look at the verbatim of this speech that you revisit that. So we have basically put forward the case. And even in making that decision, we took note of the vaccination status of persons who were coming in, among other things. So we impose a safeguard that will minimize the transmission of the virus during the short period that the cruise visitors are here. And that is why part of what we discussed was how we will create safe bubbles at Port Zante and every other location. Minister.
Thank you, PM. In terms of the vaccination, the digital vaccination card, well, let me just start by saying each country develops their own way of recording vaccination status. Once each country determine how they will provide that vaccination information, through our ministries of foreign affairs, that information is then communicated to the other countries around the world so that they are aware that this is the official means by which you would be able to note someone's vaccination status from the various country. The same thing is being done here in St. Kitts and Nevis. So the information would simply be passed to the Ministry of Foreign Affairs, who then disseminates it to the various countries, indicating what our vaccination record status cards, be it digital or otherwise, will be. While I am here, however, I just wanted to clarify or to just indicate to persons the process by which we are distributing or rather providing you with the digital vaccination card. That is, persons can present themselves with a photo ID, and if you already have your vaccination card, that vaccination card as well, to the Innovation Hub located at the National ICT Center. Once you get there, your ID and your vaccination card will be cross-checked with our database. Once the information is correct, you will then be provided with the URL and a unique ID number. Once you log on to the URL, you will then provide your first name, last name, date of birth, and the unique ID that you will be provided with. Once all of those 4 categories match, you will then be able to retrieve your digital card. Your digital card looks similar to the actual physical card. The difference is that it includes a QR code. That QR code can then be scanned just to verify that indeed you are vaccinated. This is so that persons who have the idea that they can replicate the cards even if they are not vaccinated and they may need to use it, that would give us that added security that unless that QR code matches back to our record, then you can't be able to pose as if you are vaccinated. So I hope that answers your question.
Thank you very much, Prime Minister. And I just want to reinforce the very cogent points you have made relative to the status of the unvaccinated, that they not be left behind in our country. I think you have clearly stated that the government of St. Kitts and Nevis is not mandating a vaccination of anyone, that we urge, we appeal, we encourage all our citizens to take the vaccination, because this is a tool which we are told by the science, by all the experts, that is what will protect us individually, our families, our communities, and allow us to work in a near normal capacity where we can then function as an economy, as a society together. I would want to invite, with your permission, Prime Minister, Minister Phipps as well, who is the Minister of Labour, because the question of the unvaccinated who may feel threatened in the workplace is something which the government is aware of. The fact that we have a situation of the legislation that people need to be protected by the law, but we do have pieces of legislation which gives us some protection in the community on both sides. And I would want, with your permission, Prime Minister, to let Minister Phipps just speak to that and what the Labour Department at this current time is, the direction that they're having.
Good afternoon, everyone, and thank you, AG, for inviting me to share in the response to the question posed. Before I go any further, I just wanted us to put in context the international labor relations environment in which St. Kitts and Nevis operates. And what do I mean by that? I mean that St. Kitts and Nevis, as of 1996, became a member state of the International Labour Organization. What this means is that at that time, when we became a member state, we agreed with all of the other UN member states that constitute the ILO that we would operate from the vantage point of tripartism in everything that we do. That tripartism, or the tripod, is covered by the rights of workers, it is covered by the rights of employers, and it is also covered by what we consider labor administration, in this case, the government arm, the Department of Labor. As a result of that, every attempt by member states who sign on to the ILO, every attempt is made to ensure that laws are changed, laws are created, laws are amended by consensus. And it is for that reason why there exists a committee, the National Tripartite Committee on Labor Standards, made up of representations from unions, employers such as the Chambers of Commerce, etc., and representation from the Department of Labor. That tripartism is what has gotten us to where we are in terms of the legislative infrastructure by which we rule or manage labor administration. The first piece is Chapter 18.27, which is the Protection of Employment Act that would have been initially passed in 1986, that lays out terms of employment, rules governing termination, including but not limited to conditions or litmus tests that must be met in terms of the eligibility for severance, etc. And then in 2013, Act number 12, if my memory is correct, there would have been an amendment to the original act, which basically secured three things. One, a further clarification on redundancy as one of the conditions of termination. It also made provision for the long service gratuity, which had been put in place by the previous government, albeit without necessary capitalization of the fund, because long service still comes out of the same pot that severance payment fund comes from, without being provided for. And the third thing that the amendment took care of would have been the provisions or the operationalization of the same National Tripartite Committee on Labor Standards. I say all of this to put what I'm about to say in context. That yes, we have seen a situation in St. Kitts and Nevis where a number of employers, of course, some persons are convinced that it's a straight case of deciding to terminate the employment because the persons refuse to be vaccinated. I cannot sit as the Minister of Labor and determine that that is the case of every person who gets terminated, because at the same time, we are very much in the throes of an international recession brought about by COVID-19. And having said that, several of the provisions under the qualifying criteria for severance would be clear to include and not be limited to the fact that cases can be made in terms of contraction, in terms of the local market, international or regional market. The business would have had to adjust, etc. And as such, those persons who have been made redundant or in some cases terminated because they can no longer move forward with the company, essentially that is what the company has chosen to do. So legally, the Ministry of Labor, the Department of Labor, will make every effort to ensure that the rights of workers are protected, but at the same time, based on how the laws are written, and that the rights of workers, employers, as well as what government looks at as its own role in terms of labor administration, we have to recognize that we still are governed by the law. So whatever may be our emotions, rightly placed, we still are guided by the law. The Prime Minister is absolutely correct in terms of indicating that the Department of Labor will do everything in its power to ensure that rights of workers, just like rights of employers, are protected and respected, but at the same time, the individual also has recourse to the High Court.
Thank you. Thank you very much, Minister Phipps. Just to say that this matter is being hotly debated in legal circles across the Caribbean. And whereas the Constitution does give individuals a certain amount of protection of their individual rights, there's also the question that these rights are not absolute. That's somewhat limited. Clearly, when it comes to matters of the state, your constitutional rights are protected up to a point. But in a number of matters, when it comes to the question of private law, in terms of employment, etc., this is done in a private context where questions of the labor laws, the high courts, are where you have recourse for this matter. And as the minister said, this is a question where tripartism in our country, where the employer would have a right to provide a safe working environment for themselves, their workers, their customers, but at the same time, workers also have individual rights that they can also approach a court with. So that we believe the unvaccinated, everything should be done in a soft law approach to find ways in which unvaccinated may be asked to do other types of duties where they do not come into contact with the general public, where they're asked to do maybe work from home in the first instance. I think employers have every right to request that their employees get vaccinated. They give them time, they encourage them to do so, and they find other means how to deal with these. So there is a balance involved here, but we would do everything in our power to ensure that all our citizens get the due process of law, that there's a certain level of protection in whatever they do. Mr. Prime Minister.
Thank you very much. I'll now invite Minister Grant.
Thank you, Prime Minister. I do not have the question verbatim, but I think the general essence was, what is now the position with the cruise industry since Governor DeSantis' ruling in Florida? I need to put this question in its context, though. Originally, we started the cruise industry in terms of the reopening with home porting in the Caribbean, namely home porting out of St. Martin and out of the Bahamas, I think it is. When we began that process, it was decided that the cruise lines and the cruise industry would take on board only vaccinated passengers, and that those vaccinated passengers would have the RT-PCR tests 72 hours prior to embarkation. And so we were geared up several months ago to receive the ships home porting in the Caribbean. What happened is that those that were coming out of St. Martin, the cruise vessels out of St. Martin had a peculiar entry process of persons coming to board cruise vessels, in that you could have arrived into St. Martin having had both an RT-PCR test and the antigen test. So when we were ready to receive our first set of ships out of St. Martin, a few of the passengers on board, I think it was Celebrity Equinox and the Celebrity Summit, had the antigen test, and that was several months ago. At that point in time, we were not willing to accept the antigen test for those 16, 18 persons coming on that cruise ship. However, as you would appreciate, the pandemic that we are in and the circumstances that are happening, the system is very fluid. And so the antigen test as it is now is clearly a very different antigen test in terms of its performance. But I think I'd leave the CMO to discuss that. What I want to discuss with you, however, is that those home porting in the Caribbean then moved to Florida. Then we had the ruling with DeSantis indicating that the cruise vessels were not in a position to ask the vaccination status of passengers. So that meant really that passengers could have come to St. Kitts vaccinated and unvaccinated several months ago. We were not then prepared to accept that position. As it is now, the Norwegian cruise lines challenged that position by Governor DeSantis in Florida. And actually the position is that the cruise lines can ask, well, Norwegian for sure, can ask the vaccination status of passengers. That is the position as it is now. The position of the cruise lines has always been that they want to have vaccinated persons on board. And so that is why the position is that they would have 98% of the passengers, 98% of the crew vaccinated, 95% of passengers, and that's where it's at. Now, we have indicated to cruise lines that we are prepared to accept passengers on the cruise lines 12 and up vaccinated. That means, though, that even apart from Norwegian cruise lines and the other cruise lines that we are dealing with, namely Royal Caribbean and Carnival, because of what this government has indicated to the cruise lines, they have taken that stance that they can now ask them their vaccination status because they are coming to St. Kitts. Meaning that because we have said that this is our position, the cruise lines can now ask, which means it's a way to get around the back door of the decision by Governor DeSantis in Florida. So it means that at this point in time, when we are ready, now willing and able to receive the passengers coming on cruise lines, we will know their status. I also want to assure the general public that we have also indicated that when these passengers arrive in St. Kitts and Nevis, they would go on what we determined are bubble tours, which means that, for example, if on any tour in St. Kitts and Nevis that they're going on, whether it is the Brimstone Hills, the Caribel Boutique, or the Sugar Train, whichever tour that they use, that they only will be allowed to come into contact with vaccinated persons on the tour. And we've discussed that for several months with the providers of services of tours, and they understand that. So all the persons working in these tours would be vaccinated. The passengers would not be allowed, as per usual, to just walk into the town of Bastia unhindered. That has been agreed on. We're also trying to ensure that Port Zante becomes a bubble. That's a bit more difficult, and all the teams are working feverishly to ensure that that happens. Both health, the task force, tourism, all are working in collaboration to make sure that we find a way to make Port Zante a bubble tour and make Port Zante being accessible to the passengers that come on the cruise ship so that they can be a part of the economic engine and the economic agenda of the government. So we are ensuring that we are ready to welcome our first ship to Port Zante, because as you would recognize also, ships have already started coming, but they're coming to Carambolo. But we want to make sure that we have the ships coming to Port Zante, and we are in a way that when we receive them in the best possible manner, and to make sure that we keep our citizens safe and healthy. And so we're doing everything in our power to ensure that we dot our I's and we cross our T's to ensure that when they come, they are safe. Thank you very much.
Good afternoon, everyone. I think the previous speakers would have shared quite a bit regarding the antigen test, the whole issue of the antigen test. But what I would say is that we need to remember that the inbound cruise passenger is different from the stayover passenger who would come in via air. They are only on island for less than 1 day, and as you heard earlier, they would only be participating in bubble tours, whereby they will be interacting with locals who are fully vaccinated, and so the risk is much reduced. And then in terms of the rapid antigen tests themselves, there is a lot of improvement in terms of the performance of these tests, in terms of the level of sensitivity, meaning the test's ability to pick up positives, that has improved, and this level or the rate of specificity, the test's ability to rule out the disease. And so these rapid antigen tests, their performance has improved. And so, but the bottom line is, these inbound cruise passengers, they would just be on island for less than a day, and they would only be interacting with fully vaccinated locals on bubble tours. And so the cabinet took a decision that we are at the stage to accept this level of risk. Now, since I'm here, I just wanted to speak a little bit about the COVID-19 status at present. Now, we came out of the lockdown on July 12th. That's 6 weeks ago. And we were doing well up until last week, Monday, when we started seeing a rise in the number of cases identified daily. Now, I think it was last week, Wednesday, we reported the highest number, daily count yet, 34. And that has maintained. We have continued reporting high numbers on a daily basis. Yesterday we reported 60. So at present, the total number of confirmed COVID-19 cases for the Federation stands at 883, with 805 cases for St. Kitts and 74 cases for Nevis. Now, at present, in terms of hospitalization, at the start of today, we had 10 persons admitted on the COVID ward. I think that we have had 4 discharges for the morning, and so at present we have only 6 persons admitted on the COVID ward at the JNF General Hospital. In terms of recoveries, we have had a total of 604 recoveries. So at present, we are now monitoring 276 active cases. Now, when we look at the data or the information gleaned through the contact tracing process, what are we learning about this present surge or wave or third wave of COVID-19 cases? What we realize is that there are a number of clusters occurring in St. Kitts. So, for example, there is a cluster of cases impacting the football community. There is a cluster affiliated with the Chinese community. There is a cluster affiliated with the Spanish community. We've had a few inbound passengers being identified as positive, and a few outbound passengers identified as positive. And in terms of Nevis, we are noting a few clusters of cases of COVID-19. So now what are the factors driving this increase? What we are seeing is that there is a non-adherence to the COVID-19 protective measures. So persons are interacting, intermingling, without wearing their face mask, without sanitizing hands. And as I said, they're intermingling, interacting. And so the social and physical distance has gone through the window. And so, ladies and gentlemen, we can control this third wave through simple measures. Wearing the face mask at all times. Hand sanitization, that's appropriate sanitization of hands. So if you're visiting friends, loved ones, and you are exchanging or transferring, packages, etc., sanitize your hands before and after. So these simple measures, if we adhere to them, we can reduce these numbers. So some persons are asking, why not lockdown? Now, as I said, we are coming out of a lockdown. It ended July the 12th. That's when we reopened, and we are here. And so what it is that we are not changing? We are not changing the required behavior. So behavior change is what's required. So in other words, we need to adopt the behavior. You leave in your house, you put on your mask, have your hand sanitizer in your bag, in your car. You're going out to dinner. Of late, I put on my mask between bites. I'm out eating, talking, and I put on my face mask. So that's what you have to do. That's what it means to live with COVID. And so until we change our behavior and until we adhere to these protective measures, the numbers will go up. And so lockdown isn't the answer. The answer is for each and every one of us, you and I, making that concerted effort to change how we operate, and operate knowing that the virus is now out there and that each day we go out, we have to protect ourselves from the virus. How do we do that? I'll repeat, wearing your face mask, sanitizing your hands. I have sanitization solution in my car. I have liquid soap. I have water. I wash my hands when I go in my car. It's like a face basin in my car. So that is what it means to live with COVID. So in terms of the Ministry of Health, in terms of the way forward, we will continue the active surveillance, trying to identify all the positive cases. We will continue testing, and all those cases we identify, we place in isolation. Their contacts, we interview, we place in quarantine, and we test. The way forward depends a great deal on the wholesale adoption of the COVID-19 protective measures and behavior. And of course, COVID-19 vaccination. So the Ministry of Health, we continue our vaccination program. And so the AstraZeneca Oxford vaccine is still available. And so we are asking those who would have received their first dose, make sure to come out for your second dose before this batch expires at the end of this month. And we still have a few doses remaining for those who want to come on board and accept their first dose of the AstraZeneca Oxford vaccine. I also want to use this opportunity to share with you, the general public. This is breaking news. The USA FDA just granted full approval to the Pfizer-BioNTech vaccine. So the Pfizer-BioNTech vaccine has stepped up. It's no longer under an emergency use listing authorization. It has now received full approval. So it's no longer experimental. It's a fully approved COVID-19 vaccine. And so, ladies and gentlemen, it's with pleasure that I say to you that this vaccine you will be able to access this vaccine right here in the Federation starting September the 1st. Now, in terms of strengthening our COVID-19 response, the Ministry of Health, as I said before, we continue the robust contact tracing process, and that exercise has been strengthened. More resources were required, and these resources have been provided to the contact tracing team on St. Kitts and on Nevis. In terms of testing, because the numbers are increasing, we've had to expand that team in terms of adding additional human resource, and we've added 2 additional mobile units on St. Kitts. So we now have 4 mobile units in terms of strengthening our testing team. Now, with respect to the laboratory capacity, right now we have 2 labs providing the service of COVID-19 testing, and we are working assiduously to bring 2 additional labs on board, inclusive of the JNF General lab. We continue utilizing the government-assigned isolation quarantine sites. In terms of the active cases, as I said, we are monitoring 276 active cases. Now, our aim is for these persons who have been diagnosed with COVID to recuperate and not deteriorate and end up in the hospital. And to this end, we have a team of case managers who monitor these individuals on a daily basis. So they call them once, twice, 3 times a day, just to make sure they are fine, they are well. And if any of them are deteriorating, we call the ambulance, we get them to the hospital, they are stabilized and tested, evaluated, care is provided, and they are sent back home. And recently, well, just today, we are now adding 3 more retired nurses to the team of case managers. So we will now have 7 nurses in St. Kitts, and I think 2 nurses in Nevis monitoring the active cases, and then also training of all staff members. And so this just provides you a summary of the COVID-19 status on the ground and how we are strengthening our response. Thank you.
Good afternoon to everyone. At this time, I want to report on the status of the investigation with the hush puppy matter. I am pleased to say the investigation is progressing smoothly with the assistance of our U.S. counterpart. To date, no one has been arrested. Thus, I am unable to name any suspect at this time. Thank you.
Thank you very much. Are there any further questions?
Yes, 2 final questions for me. As a result of the current wave of COVID-19, that has included dozens of hospitalizations and a significant number of recoveries, what does this say about the health sector in St. Kitts and Nevis? And lastly, what long-term effects from COVID-19 have been recorded from patients here in St. Kitts and Nevis?
CMO? Oh, well, is there any further question before we call the CMO?
Kevon Brown again for WinFM. Can we get an official comment on the protest action that occurred on Friday and its aftermath? Thank you.
What would you like, sir? I'm not sure.
A comment on the protest action.
Oh, okay.
Jason Davis, once again from ZIZ. 2 questions. If the number of positive cases continues to rise, how will that impact the upcoming CPL matches? And secondly, can we get an update on the new apartments that are being constructed, or that have been constructed on Wellington Road? I think that would go to Mr. Hamilton.
Thanks. We will now invite our Chief Medical Officer, and she will address those issues that have been posed of concern to the health sector. And then we have the Minister Hamilton will address the issue of the apartments at Wellington Road. And then Mr. Brandy may want to address the matter of the protest action. CMO.
Okay, I'm not sure I fully got the question regarding the health sector and COVID. If you can just repeat, Sam.
With this significant amount of recoveries we've had from hospitalizations and COVID patients in general, well, what does it say about the health sector in St. Kitts and Nevis? And what are the long-term effects reported by COVID patients in St. Kitts and Nevis?
Okay, I'll start with the last question in terms of the long-term effects. We've just had our second and we are now going through our third wave. It's a bit early in terms of getting that bit of data in terms of long COVID. Long COVID is the term they're using to describe the prolonged symptoms being experienced by COVID-19 survivors. And yes, some are talking about extreme tiredness and fatigue, but it's a bit early yet, but we are capturing this data. So probably at the next press conference, I could provide you more information regarding the local experience in terms of long COVID. Now, we've only had 3 COVID-19 related deaths. All of our cases have recovered. What does that say about the health sector? I think we have been responsive in terms of picking up the COVID-19 cases early, and our model of having a team of COVID-19 case managers who monitor our cases on a daily basis, and as soon as you start complaining of any red flag symptoms, the ambulance is sent for you, you are sent to the hospital, we evaluate you, we treat you, stabilize you, send you home, and those who require hospitalization, they're admitted on the ward and treated. And I think this model is working well for us. In other words, we are using preventive care. We are preventing the cases from developing complications. We are stabilizing them early before they reach the point of no return. And so this model is working well for us. And I think I can also say that our people too, I think they have come on board in terms of boosting their own immune system. A lot of persons are doing that. Just 2 days ago, I interacted with a COVID case. She is actually on today's day 12 since she's been diagnosed. And, you know, I called her and I said, but I don't like how you sound. You sound very chesty and a bit short of breath. But she said, Dr. Laws, I am sounding much better now. And can I tell you what I'm using? My father tells me that I need to have this concoction 3 times a day. So I said, what's in this concoction? And then she said, it's turmeric, it's ginger, and it's garlic. So I said, tell him that he needs to give you for 3 more days so that we don't really have to send the ambulance for you. So she was taking the local concoction along with her supplements, which was vitamin C, D, and zinc. So yes, our health sector, we've responded well to this outbreak, and our people have responded well, and they've listened to the information that we would have shared in terms of preparing oneself and boosting one's own immune system, such that if you're impacted by the disease, you can fight it off. There's a question about if the cases increase and CPL. I could just comment briefly. In terms of CPL, the CPL cohort, they have come in and they are in a bubble, and this bubble will be maintained throughout the CPL games until they depart. And so the CPL cohort members will not be interacting with the general public. Minister, if I'm right, you could correct me. And in terms of the spectators, fully vaccinated spectators, and if their child, if their dependent is with them and the individual is a child unvaccinated, that child is also allowed. And so we think that, and also I must add, it's 50% capacity in the stadium. And so these measures would, there would be minimal risk in terms of this adding to what's happening on the ground. Thank you.
Minister Hamilton.
Thank you, Jason, for the question, and it is really a short answer. The Wellington Road housing project, all of the hurdles that we may have had, we have surmounted by the 4th day of August, the day before we held Parliament. And it was decided that we will distribute those homes on the 27th, which is Friday coming. But on Saturday, when I met with the team doing the entire work, the planning, we recognized that there were some issues that came up. And so rather than distribute on Friday, we will have an open house day on Friday, giving those persons who are likely to occupy, and maybe others, an opportunity to go and see the apartment furnished by one of our merchants in Bastia. You get an opportunity to see what it will be like, and then we'll do the distribution early in September. I have 2 dates, the 7th or the 14th, but the 7th is my birthday, so maybe I'll choose the 14th. That's a short answer.
Mr. Bandy, do you want ACP Adolphus Adams?
Good afternoon, and thank you, Mr. Prime Minister. Firstly, my name is Adolph Adams, Assistant Commissioner of Police with responsibilities for operations. I would like to thank the law-abiding citizens and condemn those lawbreakers who are intent on breaking the law. I must make it abundantly clear that the Royal St. Christopher and Nevis Police Force, we are not against freedom of speech, we are not against freedom to assemble, we are not against freedom of expression, and we also are not against peaceful protesting. But what we are saying, if you wish to do so, you must do it within the confines of the law. And at this time, we must adhere to all the COVID-19 protocols. We also want to say, don't just show up on Friday to engage in lawlessness. Otherwise, the police force will take all necessary actions to ensure the safety and security of our federation. We had an illegal procession in Bastia on Friday, and up to this date, no permission was sought from the Commissioner of Police to have such match. The law gives you the rights to apply. The law also said that you must outline what you intend to do, where you intend to march, how many persons, and you must indicate a route where you intend to do whatever you want to do. Reason being is because the law prohibits you from farming or marching in certain areas, and the Commissioner of Police must be made aware of all the necessary information before he can grant you permission. One of the reasons why I would say we would not allow any illegal marches or procession in the Federation, one is because marches or processions do not always remain peaceful. Sometimes you start out peaceful and you end up endangering others. Two, people may hide behind, have their own different agendas. It could be political. We know person was saying that the march was about the vaccination. But when you saw the placards that were being displayed, we can say that there was some level of politics being engaged in these protests. Illegal marches can cause property damage or structural damage to businesses, and so we would want to, not allow those things to happen within our federation. We also are saying illegal marches in the night are prohibited. We have seen the march on Friday going down to the wee hours of Friday evening, and these things are prohibited by the law. Reason why these are not allowed are because persons can hide behind the cover of darkness and engage in any type of activities. All right? We have officers who are out there on the ground, and we will do all in our power to ensure that our safety, the safety of the general public, is maintained at all times. As a result of the illegal march or protest on Friday, 3 persons were arrested and charges were brought against them. That is my update on the protest that took place on Friday. Thank you.
Thank you very much, ACP Adams. I think we have exhausted. Is there any further input? If not, we want to say thank you to all our friends of the media who have come to help in the dissemination of information regarding development in our country. We thank you for coming forward and for the constructive role you play. I want to thank all cabinet colleagues, high officials of the government who have come out and have made themselves available to be able to respond to some matters specific to their particular domain, and therefore added value to this national press conference. I want, of course, to thank our security forces and to let them know that our country holds them up in prayers, because they are doing a very difficult job at a very difficult period of time, and they are doing it for love of country. So all who are engaged in law enforcement, we commend you and thank you for your service to the country. And of course, the safety and security of our country must never be compromised. So again, we stand with you, and all law-abiding persons stand with you in executing your work in accordance with the law and the Constitution. May God continue to bless the people of St. Kitts and Nevis, and may He also protect us. Thank you again, one and all, for participation. God bless us. Thank you.